give a bit of introduction for myself. So I'm Ellie. I'm the niece of Mandy, so the founder of the foundation. I am coming today as the coordinator, which I was appointed 12 months ago. This project has been a long time waiting, and it's just really exciting to be able to present this to you. We are still not published yet, so please keep this information to yourself, but I'll hold back from my excitement because we don't want to get ahead of ourselves, but we're really hoping it's going to be, I guess, a publication that will really change the future of the care for all of our families. Okay. So this is Matthew and Tim. So I am younger than both Matthew and Tim, so I grew up with them as a kid to now. So when I was learning to walk, to run, to participate, Matthew and Tim were doing the same, but then they started to decline. So I remember when I could walk alongside Tim. I remember when I could eat alongside Tim, and then slowly over time, Tim needed more aids. He needed help with eating, and then he wasn't able to eat and gets fed through a tube. And his mobility went from being able to walk to needing a gait aid to being in a chair. So I grew up and I felt like I saw this all from a distance. So I live about 3 hours away from my family in Benalla. And I really wanted to get a better idea. So when I was mid-university and wanting to learn more about NPC, but also just not knowing where I wanted to go with my life, as you do in university, my auntie suggested going into genetic counselling. So I decided to, I decided to get into support work so I could learn more about disability and enter into a Masters of Genomics and Health course. So if you click on to the next, I actually no idea. So this is Marla. So when I became a support worker, I started working with Marla. Marla is a beautiful human being, and she has sadly passed away, but learning so much from Marla has really broadened my eyes to what NPC truly is. So I worked with Marla throughout COVID. So I saw how her gait was declining. I saw how her eating was declining. And I saw how her brain it was changing over time, and it was changing so rapidly, it really shocked me. So it was a massive introduction to NPC and what it was really all about. And I think that's when I really jumped headfirst into wanting to volunteer my time, wanting to write my science blog, it's the NPC Corner, and being able to really make a difference. And then when this project popped up, I jumped on it. So I wanted to highlight some of the key issues that we have with NPC. For everyone here, lack of awareness. I really think that if more people knew, then we could be doing so much more funds. But a lack of awareness is really challenging because it also leads to a lack of medical guidance on what to do. So if you're handed a patient or you identify a patient with NPC, there's no real guide for Australia. There is an international guide that was in 2018, but there's nothing out there. You kind of have to talk to somebody who's an NPC, and if you haven't got anyone available, you do your best by general guideline standards. Which leads to a lot of inconsistent healthcare experiences. You can talk to a variety of families in this room, and you are likely to get very different stories. And we really want in the future for that to be different. We want to make sure that we can get people following a standard of care that means that they can have a good healthcare experience. It's also challenging when there is no official approved therapies in Australia. I know miglustat is one of those grey area ones. It's approved for a different condition, but it has made it quite challenging to access, I guess, care and knowing where to go, how to manage, because there really isn't anything in print saying, okay, you've got NPC, this is your treatment. And alongside all this, is navigating it is the caregiver burden. It's amazing what these families get to do, and I hear it all the time with my auntie, but I also hear it with the families that I speak to and who I've spoken to throughout this project. So to address all of these things, we wanted to make a guideline that could really change the scope of NPC. So this is the international paper that I was talking about before. It was made in 2018. It's generally US-based, but it's quite general in nature, and it doesn't really address anything Australia-focused. So for example, it's quite general in nature and doesn't factor in the PBS, it doesn't factor in NDIS, and our system is very unique, and we are very unique as our country. We really want to make sure that the recommendations that we have, we can actually use. So we decided to come up with this aim. You can read it for yourself. But generally, we wanted to be able to better identify, diagnose, and manage NPC for our families in Australia. And these were the two hopes. We really wanted to increase the knowledge. We wanted to help professionals use these standards and create these standards so that there's a better quality of healthcare treatment. And then for families, we really wanted to decrease that stress. So it kind of addressed that caregiver burden, increase the confidence in the healthcare team, and the overall care for the person living with NPC and their quality of life and healthcare experience. All right, so basically when we started out, we really wanted to get a bunch of professionals that knew what they were doing, because I came in and was like, all right, how are we doing this? We managed to get, as you all know, Professor Mark Walterfang, who is brilliant and is one of the key people for NPC in Australia. We also managed to recruit Dr. Michael Chan, Dr. Nick Smith, and Dr. Heidi Peters, all brilliant clinicians, and were really instrumental in our project. Also a very important person is Pip, who has been wonderful in bringing in the community perspective in every step of our project. And then recruiting Hazel Palmer, who has also worked on other rare diseases, but she basically brought all of our chatter, all of our discussions into a brilliant manuscript, which is currently still being developed, but is soon to be submitted to a journal. And we recruited a very wide advisory group. So for a condition this small, the fact that we managed to get 40 or almost 40 people to join us was brilliant. We were able to get clinicians from, as you can see, all over Australia, even one in the UK. And then the community advisor group were, again, all over Australia and even one in New Zealand. So you can see there's a variety of geographical spread as well as occupations. We really tried to get a big group because there's no point all clinicians from one discipline feeding into a guideline that is meant to be really comprehensive and address all these areas of this multi-systemic disease. So what we did is we took that 2018 paper and we split it into 5 different sections. So we focused on everything from incidence or identification of the disease down into genetic testing and management. So we really tried to cover all areas. And we did this by doing monthly surveys. So we followed like a Delphi method. We basically got people to say how much they agreed with the statement and if they had any comments. And as you can see here, there's a statement and then we had everyone's comments. And we were, as a group, just discussing it, saying, I don't agree with this wording, this doesn't make sense in my experience. And having the families bring up their personal experiences was wonderful because it meant that we were able to say, oh, that actually makes sense, or that doesn't practically translate, or we're missing this really key component. So it was a really wonderful experience to be able to have these meetings and hear from people, not just kind of get a survey and that was done. And out of this, so this is the unpublished results, out of this we developed 22 consensus statements. So in that original 2018 document, it was about 39 statements. So being able to cut it down to really the basic, most important ones was really helpful to make it way more easy to understand. And we covered, again, everything from the kind of clinical suspicion / identification of the disease all the way to future therapies, management, and really tried to provide as much information that was specific and helpful so that someone could use this guideline to actually impact their care. So I'm going to go through some of the key things. First of all, we have the clinical red flags table. So this is a brand new, we were able to say, okay, you've got a patient who may or may not have a condition or you're not really sure what it is. This is something that you say, okay, I've got a clinical group, but I'm also seeing these other signs. Could it be NPC? And I think this is something that we really want to try and get clinicians to think of, because even if their patients don't have NPC, we want them to think of NPC when they're trying to figure out a diagnosis. So this was really helpful and I think would be great if we can get more awareness of this figure. Another one is a diagnostic algorithm. So this might change a little bit, but essentially it's an adaptation of other algorithms. It's a way to diagnose, and I think with genetic testing, as Mark was talking about earlier, genetic testing is really changing the landscape of this and making it quite much more quick. But even in our discussions, we were noticing that some clinicians weren't going straight to genetic testing where others were. So kind of having a consensus on which process to follow, I think is really helpful to kind of, like I said before, make that healthcare experience a bit more consistent across families and across states. And this is definitely one that I think is important for families, is knowing what areas are impacted by the disease and what assessments you should really be doing. So if you have a situation where there's issues with gait, with walking, okay, who's the professional? How often are you meant to get assessed? What are they meant to assess? And then what can they do for you? What reports potentially would they need to be going through? It's really helpful to have this all laid out, because it means that you can kind of, I don't know, you could print this off and tick it off. So at least you know what needs to be involved. And I think by this next image, you see a lot needs to be involved. This is one of the figures that we're most proud of, because it really shows how many people are involved in the care. This is not a comprehensive list. It's something that is really amazing to see, is that parents have to navigate this, and they are included in the core medical team. They've always been included in the core medical team, but this is the first time it's really been shown this way. So the parents are often the support coordinators, they are often the advocates, they are often the managers of all the schedules. And it's just, I think this is a paper that really acknowledged that, and showed that we need help in doing that. It's a full-time job, but also who else is meant to be involved in trying to, like I said, make a bit more of a consensus on who should be involved, and who can help coordinate all of that. So very proud of this. And I also think it's really important that we included the future, I guess, what's on the horizon. We know that there's nothing approved in Australia at the moment. That doesn't mean there never will be, and I think that is always a sign for hope. And having something like this means that a clinician can say, oh, okay, there may not be a cure, but there's something coming. There's therapies coming. And so I'm going to keep an eye on the clinical trials. I'm going to see if these things are going to be approved in the future. I'm going to try and be there, trying to advocate. And we really want to try and emphasize that things are there, things are coming, but it's up to the clinicians, up to them to keep an eye on it and make sure that hopefully as soon as it becomes available, they jump on it and it's there. I wanted to go over some key learnings before I finish up. It was amazing, like I said, to go through, I guess, all these discussions with people from all over Australia. So how they do things in Queensland or WA is different to how they do it here. And we're talking about cross disciplines as well as across different hospitals. So getting that perspective really helped identify barriers that are there, such as communicating information between hospitals. But even just the breadth of knowledge and perspective and expertise was brilliant to draw upon. So it was real, I think, real key part of this that made it so special. Advocacy is very important. I think I'm preaching to the choir here. Advocacy in a rare disease is obviously very important, but also just, I think the strength of networks and connections and word of mouth in this, the fact that we're able to collect over 30 medical professionals for such a rare disease is amazing. And I think if we keep leveraging that and keep advocating and keep speaking up about the disease, we're really going to try and push these guidelines out to circles where they should be. And then hopefully that can improve the standard of care for families all over Australia. Lived experience is so valuable because there are heaps of elements in this guideline that drew upon personal experiences. And there were times when we had statements all confirmed by a clinical medical advice board, and then we would have a parent say, oh, but this was also my experience with this factor in. I'm like, oh, that makes so much sense. This completely changes the way that we are looking at this. We need to include ABC now in the guideline because of that. So thank you so much for sharing your experience. I think consumer involvement now in this era of research is becoming super important, and this project shows why. This is a community-funded project. This is a community co-design project. I think it's brilliant that they've been involved the whole way through, because this is essentially for our community. So it was great working with the families, and I do want to acknowledge them at the end. So next, we're hoping to create a clinical summary of our main document once it is published, and then we're going to create community accessible resources. So we're going to be breaking down this big manuscript into all these digestible little chunks, and with the help of the health communications volunteer group, hopefully make that into, I guess, more usable resources for our families. For example, expanding the sections such as like physiotherapy or speech pathology, things like that, to make it easier for families to use. And that'll hopefully be available on the website in the future, but don't quote me when. And thank you so much for listening. I just wanted to do a massive acknowledgement and thank you to everyone who was involved. It was amazing, as I said, I've used that word a few times today, to be involved in a project that was so, I felt like it was so impactful, even though we haven't even published it yet. Even learning from families, learning from other clinicians, getting everyone in the same room and starting to build some of those connections and networks, it was absolutely wonderful. And this is everyone who's involved in our advisory board. And again, special thank you to Hazel at the very end, who is still working on our manuscript, and we could have not done it without her. She came in full throttle with all her passion, and yeah, I'm really excited to see the next steps. So thank you. Does anyone have any questions?
Thank you very much, Ellie. Many hours in meetings and emails have been spent putting this together. So Ellie is now the official clinician wrangler. She's got it down to a fine art to get everyone to have time available at the same day, same time. It's amazing. Are there any questions at all? Excellent. Amy, yeah?
Sorry, it's not a question. I just want to congratulate you, Ellie, on just doing such an amazing job in the time frame that you did it. And that wouldn't have been an easy role, particularly, you know, getting everyone aboard within the clinical space and navigating that. So I just think well done. And really thank you to Mandy and Deanna and prioritising this amazing project and look at the outcomes. So well done. Great job.
Thank you, but you take some credit too.